Thank you so much for joining us for Mental Health Advocacy Day. My name is Lori Emerson, and I am the Executive Director of the National Alliance on Mental Illness of Vermont. Mental Health Advocacy Day is an opportunity for us as advocates to raise awareness about mental health, to inform and educate our legislators. Our theme is Hope Starts Here. Prioritize, invest, and connect for mental wellness. This is our 10th year in joining together as a united coalition. And I want to thank all of you for attending today, with a special thank you to our legislators who are here and our state leaders. We were very ambitious this year to include both in-person and virtual, and it did test us, didn't it? We're so grateful to the artists who shared their art for our slideshow this morning, and appreciate the Howard Center Art Collective who helped to get the word out. We thank Sydney and Michelle, who are our ASL interpreters, and we are very excited to announce a great lineup for our agenda, beginning with a state leader welcome, followed by a legislative panel discussion, moderated by Commissioner Emily Haas, a presentation of awards that you voted on to determine our award recipients, and sharing stories. Testimony's been scheduled for both the morning and afternoon over at the State House, and you're all welcome to participate in the afternoon with us. So please join us at the cafeteria at noon, where lunch will be on your own, and we'll have a press conference at the State House Cedar Creek room, where you're all invited. This is on the first floor and will be at 1 p.m. today. We hope you will be there to show your support. And I will be giving a devotional at the start of the House chamber session at 3 p.m. The House of Representatives will recognize us with a resolution, so please join us in the balcony for this exciting event as it continues at the State House. This event will be recorded by Orca Media and can be accessed on our website later on. And the press conference will be live streamed on their website. Now, if you need support today, because sometimes there may be triggering topics, in the back of the room is Kathy Johnson, who is a NAMI Vermont support group leader, and she can help you. She has a blue sweater on today. And if you're joining by webinar, please type your name and organization in the chat and let us know if you have organized a watch party with the number of people that are joining. So we'd be really excited to see how many people are joining online. If participants in the webinar find that you need support, call 988 or text VT to 741-741. These resources will be shared in the chat for your reference. And at the end of the event, an evaluation link will be displayed on your screen if you're attending online. And we ask that you take a minute to share your feedback with us. And I'll be sharing an evaluation with all of you through email, and hope that you will provide us with feedback as well. If you need to use the restrooms, you would just go down the hall and take a right, and those would be the only restrooms that are available. Now, going to the State House, we can also leave, taking a left and going out the exit, but we can't come back in that door. So with that, I now want to turn it over to Martina Anderson from the Vermont Association of Mental Health and Addiction Recovery.
Hi, good morning, everyone. It's truly an honor to stand here before you all today on Mental Health Advocacy Day on behalf of VAMHAR, the Vermont Association for Mental Health and Addiction Recovery. This is a day where we come together as advocates, as leaders, partners, and community members to amplify the importance of mental health and commit to bold and collective action, which is not just exciting, but so deeply necessary in this moment and going forward. But first, I really want to take a moment to express my deepest gratitude for our incredible co-sponsors for their invaluable support and collaboration in making this event possible. We have 57 co-sponsors represented. Yes, 57. That's amazing. Thank you so much. Your leadership and dedication inspire us all to continue this critical work. Thank you for standing with us to create a Vermont where mental health is treated with the urgency and compassion it deserves. I believe we are all here today because we recognize that mental health impacts every single one of us, whether it is a family member, a friend, a colleague, or maybe even ourselves. Mental health is woven into the fabric of our lives. And yet, for too long, our systems and our communities have struggled to provide the comprehensive care that support Vermonters who need and deserve this care. And this is why collaboration must be the foundation of everything that we do. Mental health is not just a healthcare issue. It is an education issue, a workplace issue, a housing issue, a justice issue. And addressing mental health requires us to look beyond our individual organizations, to look beyond our individual agencies and our individual sectors, and to commit to working together in new and transformative ways. Because we have seen what happens when systems operate in silos. People fall through the cracks. Families are left without answers, and too often, stigma and shame prevent individuals from seeking the care that they need and deserve. And this is why Mental Health Advocacy Day is so powerful. It brings us all together, not just to talk about mental health, but to build partnerships, to share resources and inspire action. And collaboration means meeting people where they are at. It means listening to those with lived experiences and ensuring that their voices are at the center of decision making. It means strengthening the connections between schools, healthcare providers, community organizations, and policymakers so that Vermonters can access support when and where they need it most. Yes, we have made progress. Programs and initiatives across Vermont are showing us what is possible when we are working together. But there is so much more that needs to be done. Mental health does not wait. Mental health cannot wait. So today is our chance to show that we are ready to rise to the challenge. And as we move through today together, let us remember that real change happens when we do come together. Yes, hope does start here. And let us honor the courage of those who are sharing their stories and advocate for better systems, who continue to advocate for better systems. And let us leave here not just inspired, but committed to working together across every sector, every community, and every difference to make Vermont a place where mental health is a priority. Thank you all for being here. Thank you for your passion. Thank you for your partnership, because together we are building a more hopeful Vermont. And I'm honored to now pass it to Amy Johnson from Vermont Care Partners. Thank you.
Thanks, Lori and Martina. They're such wonderful speakers, and my remarks are written down so I don't say the F word too much. I'm Amy Johnson. I'm the Director of Government Affairs and Communications for Vermont Care Partners. We're a network of 16 mental health agencies, substance use agencies, and agencies for individuals with developmental and intellectual disabilities. And I'm excited to be here, excited you're all here, and I'm going to read off this paper again because I'm a loose cannon sometimes. So today we come together not just as advocates but as change makers at a time when our work has never felt more urgent. We know the road ahead is difficult, and I know for many it's been a tough week with news that has weighted heavily on so many of us. It feels like the world is pushing back in ways that make us question how much impact we can really have. But let me be clear, this is the moment when we need to dig in, not tap out. We are here because we believe in the power of hope, the strength of perseverance, and the undeniable truth that each of us, just one person, can make a difference. One voice can start a ripple effect that changes the lives of those we serve and reshape policies that affect them. And while it's tempting to feel discouraged, we must remember that some of the biggest policy shifts, the most groundbreaking changes in history, began with just one person standing up and saying, "I won't give up on this." We are here to be those people, to stand firm in the face of adversity, knowing that together we are the change that's needed. Today, we also take a moment to recognize the incredible service providers in this room making a difference. The ones who have shown up day in and day out, often when they too were running on empty. You've worked tirelessly, sometimes without the recognition, oftentimes without the recognition you deserve, to support Vermonters who are navigating the toughest of times. You've been a lifeline for so many, offering care and hope, even when it felt like there wasn't enough to go around. Your dedication is what keeps the doors open and the light shining in moments of darkness. We see you, we honor you, and we are grateful for every ounce of strength you bring to this fight. Let's also remember, when working tirelessly to advocate for better mental health and substance use policies and investment for the people we support, that what we're fighting for is people. People who are too often misunderstood or wrongly blamed for problems that go far deeper than what's often visible on the surface. Mental health and substance use challenges are not the cause of the issues we face. They are symptoms of deeper, long-lasting gaps in our systems that we must address. Individuals with mental health and substance use needs are not the source of the challenges we face. They are the ones who have long been left behind, and we have the power to change that narrative. So as we face the tough realities of the moment, let's remember that we are here to create understanding, not stigma, to build solutions, not barriers. The world might feel like it's pushing us to give up, but we're not backing down. We are in this together, and together we will be the ones to turn the tide. Let us not tap out now. The work is hard, but it's in the hardest times that the most lasting change is made. And I believe I'm bringing up Daniel from VAMHAR.
Good morning, everybody. So it's my honor, my name is Daniel Franklin. I'm the Executive Director of the Vermont Association for Mental Health and Addiction Recovery. It's my honor to bring up some of our special guests here this morning. But before I do that, I just want to first of all thank our ASL interpreters. I mean, what a gift to be able to watch this and to see such a representation of the words and the power behind those words in this form. And also just a quick word of thanks thanks to the folks who make this event happen and are our champions. Lori Emerson, this is the 10th year of the Mental Health Advocacy Day, and Lori Emerson has it down to a science and is just an incredible gift to our system of care and all of us, and Martina Anderson and Amy Johnson, and then all the others who contributed to make this day possible. So just let's give a round of applause for everybody. It's my honor to bring up the Speaker of the House of Representatives, Joe Kowinski.
Hi, everyone. Good morning and welcome. Welcome to the State House complex. It's great. It was a little dicey coming in, so I'm glad you all made it here safely. Thank you so much for being here today and showing your support for such a critical issue, mental health. When we come together, we accomplish more than any one of us could do alone, and that is what today is about, the power of collaboration. The theme for today, Hope Starts Here, is the perfect foundation for the work ahead of us. Whether you're a legislator, an advocate, or a citizen speaking up for change, we all come to the State House with hope. Hope that we can make progress, hope that we can make sure every voice is heard, hope that together we can build a better future for all Vermonters. Mental Health Advocacy Day gives us the opportunity to acknowledge the progress that we've made and to continue to confront the challenges that remain. One of my top priorities for this session is accountability and checking in to make sure our government programs are working, diving in to make sure that the bills are being implemented and programs are being successful. Working in our government programs and diving into what's working and what needs to be further examined or reworked. I'm proud of the progress that the legislature has made over the past decade since our first Mental Health Advocacy Day. Congratulations on 10 years, but we all know that this work continues and that there's so much more to be done. Legislators in the room and around the building today, as you listen to testimony and the lived experiences of Vermonters today, I urge all of you to hold on to these stories and use it as a guide to make the change that is needed. The challenges in our mental health care system can be overwhelming, but if each of us brings even a small spark of hope, a willingness to ask hard questions, and the determination to roll up our sleeves, we can make real, lasting progress that Vermonters are counting on. So thank you to the providers, the advocates, all of you. Your voices matter so much in this work. So have a great day here today and look forward to seeing you in the building. Be well.
Please now welcome the Secretary of the Agency of Human Services, Jenny Samuelson.
Thanks, Matt. Good morning. As the Secretary of the Agency of Human Services, it's an honor to be here for this 10th Annual Health Advocacy Day. A decade of coming together for shared cause is a significant accomplishment, and it's a privilege to celebrate this milestone with so many passionate advocates, leaders, and community members. At its core, today is about connection, connecting with each other, building hope, with the stories that inspire us, and with the shared mission to ensure that mental health care is accessible to everyone who needs it. Each of us brings a unique perspective to this work, and it's a diversity of experience that strengthens our efforts and drives meaningful progress. At the core, it's about collaboration. I'd like to take a moment to thank our hosts, NAMI, Vermont Healthcare Partners, and VAMHAR. Your leadership and dedication to improving mental health care in Vermont are what makes events like this possible and creates ripples of change across the state, especially making sure that people's voices with lived experience come through. We've come a long way in making mental health a priority. The conversations we're having today, openly, without stigma, might not have been possible a generation ago. But we also know that the road ahead requires persistence and collaboration. Real change doesn't happen overnight. It's built through countless small steps, often behind the scenes by individuals and organizations who refuse to give up on the vision of a better system. And here in Vermont, we're seeing the impacts of that work. Programs like mobile crisis teams are meeting people where they are, literally, offering immediate care and support in our communities. The expansion of mental health urgent cares locations is another critical step, ensuring Vermonters have a place to go when they need help the most. And 988 Suicide and Crisis Line is connecting people with compassionate support right here in our state. These are significant investments and significant steps forward. These initiatives, collaborations between legislators, providers, the Department of Health, among many others, remind us that progress is possible through our collaborative efforts, and more importantly, that it isn't just about systems or policies, it's about people. It's about creating moments of connection, understanding, and support. It's about making every Vermonter feel seen, heard, and valued. These programs also represent significant shifts in how mental health supports are provided. As a community of providers, we are meeting people where they are and when it's needed. We aren't waiting for people to come to us. More and more often, the people who respond have lived experience. Having a peer who knows what it's like is foundational, and having those peers and folks with lived experience is important in helping drive good policy. It also represents co-occurring care and interdisciplinary teaming so that we're promoting collaboration, not just at the policy and organizational level, but at the care level, where an individual gets whole person care so that we're not segregating out mental health and physical health. It's also trauma-informed. I don't want to sugarcoat it. These changes have taken a lot of work, coupled with the post-pandemic stressors on mental health and the uncertainty in the world that we face right now, the demographic challenges in Vermont, and the housing crisis. It's taken many of you and many of us effort and hard work to provide care and support needed and develop and move forward both these policies and the care that's delivered to Vermont. I want to make sure that each and every one of us hears thank you for those efforts. It's taken a lot from our families and from us individually to make sure that Vermonters are served and served well. Your efforts have improved and saved lives. 1 in 6 Vermonters in Vermont faces mental health challenges, and the reality that each of us is likely to know someone, whether a friend, family member, or neighbor, who is navigating this journey. It also impacts each of us and our own journey personally and deeply. The work that we all do together, whether on the front lines or behind the scenes, matters. Your commitment helps create a foundation of hope and resilience for countless individuals, families, and communities. As we reflect on this milestone and look ahead, I encourage all of us to celebrate the progress that we've made, even as we continue to push more and to see additional gaps in front of us. Let's make today as a reminder of what's possible when we work together. The strengths in this room, the passion and the dedication of this community gives me hope for what we can achieve in the years to come and together. Thank you for showing up, not just today, but every day for Vermonters. Let's carry the energy and inspiration of this gathering back into our communities and continue the important work of building a mental health system that serves everyone, everywhere. Thank you.
As I look out at this crowd, one of the things that really makes me excited is to see all of the young people in this room, the students who maybe are in master's programs or studying or interested in the mental health field. We need you. We need you so bad. We have champions like Marjorie LeMay here who's about to retire and move on in her life. And for every person that retires, we need more mental health providers. So if you're out there, I'm so excited to see you, and thank you for being here, and know that this is your community, and we can't wait to welcome you into the field. It's now my pleasure to bring up the Commissioner of the Department of Mental Health for Vermont, Commissioner Emily Haas.
Hi, good morning. Do I get to push any of those buttons?
You could. Technical difficulties, don't.
Okay. That wouldn't be the first time that I got in trouble at a podium, so. Hello, good morning. Like my introduction indicated, my name is Emily Haas, and I get to be the Commissioner for the Department of Mental Health. And I use the phrase, I get to be, very purposefully, because it is an honor to stand up here and be the Commissioner on behalf of you all and the state. So I'm so honored, like I said, and grateful to be here on the 10th anniversary of Mental Health Advocacy Day. This milestone reminds me that each year matters because of the people who show up and the progress that we all make together. Today, folks are here as advocates, providers, legislators, leaders, and more. But above all, we're here as individuals whose unique journeys have brought us to the mental health field. Bringing our diverse perspectives and experiences to this work is what makes our community stronger. A special thank you to our host, NAMI Vermont, the Vermont Care Partners, and VAMHAR for making today possible, and for the work you do to support our mental health community. I have to move that over. Our mental health is a significant part of our overall well-being, and having access to mental health services and support we need is fundamental to our quality of life. We're starting to hear more and more often, but honestly, it's easy for these words to lose their impact when they're said so frequently. We all have mental health. I'm incredibly grateful that as a society, we've reached a point where it's easier to acknowledge that, and that taking care of our mental health is important. And a big part of this shift is due to gatherings like this one, which help reduce stigma, give us a place to share, support one another, and learn. But some of the most meaningful progress in our communities comes from the hard work that often happens behind the scenes. It happens in the late nights spent researching and writing policies. I think I had some DMH folks that were sending me policy stuff at 10 o'clock last night, and so I know that that's happening behind the scenes across our entire health system, and it is much appreciated. It's also in the volunteer who answers a call at 2 a.m., or the counselor who stays late to make sure someone has a plan for the next day. And it's in the simple yet powerful act of checking in with a neighbor or a friend, asking how they're doing, listening without judgment, and showing that they're not alone. As Secretary Samuelson said earlier, 1 in 6 adults face mental health challenges. And so many of you are on the front lines, meeting people where they are and providing support that directly impacts lives. And it doesn't always get the most notoriety, but it's essential. And it's certainly not glamorous. You are all incredibly important, and without each of you, the progress we're striving for wouldn't be possible. It's so important, especially in the field, to take moments to recognize and celebrate what we've accomplished, to find pockets of hope and joy to keep us going. So I want to share a couple of things that Secretary Samuelson also highlighted, and we're highlighting them as many times as possible because we want folks to access care. And those opportunities to access care come with a call to 988, with Vermont having almost a 90% answer rate, which means that those 988 calls are answered by someone who is in Vermont and offering you supports right then and there. We also have the enhanced mobile crisis response, where folks are responding to an individual in the community who needs and wants to be seen right then and there. And then we've also incorporated the mental health urgent cares, where individuals, if they choose to not go to an emergency room, which we know a lot of folks don't want to go to an emergency room. It's chaos there at times. So we have an opportunity for folks to get care in the mental health urgent care space if they need that. And so I hope that folks are aware of what those urgent cares are in your communities and also how to access them should you need them. All of this is part of a bigger shift in Vermont. More than ever, when you face a mental health challenge, the support you receive is likely to come from someone within your own community, someone who understands what's happening with your local challenges, knows the resources locally, and offers care with empathy and familiarity. These changes are transforming the care people receive and bringing us closer to the kind of mental health system Vermonters deserve. And as we move into 2025, well, we've been in 2025 for a little bit, but it also feels like the longest month ever. Remember that the work you do matters. Celebrate progress, big or small, that you've made. It takes all of us working together to ensure everyone has access to the care they need. And let's carry the conversations and motivation forward. And most of all, hope we find today with us into our communities. Thank you all for having me here today. I'm excited about the energy in the room and the energy online, and I look forward to how this day unfolds in our future. Thank you.
Now to read a letter from Senator Bernie Sanders is Amy Johnson.
I'm not going to do a Bernie accent, but I considered it, and I think it'd be too hard to maintain it the whole time. The senator sends his regrets, and his staffers do too, so I get to be the fun person to present this on behalf of Bernie Sanders. Dear friends, thank you for gathering to advocate for a strong and fair mental health system in Vermont. Let me be clear, mental health care is health care. Mental health is a central component of overall well-being. It is imperative that the many people who cope daily with some type of mental health challenge have access to mental health care. Unfortunately, I hear all too often from Vermonters who struggle to access and afford mental health care. In the wealthiest country in the history of the world, we must guarantee mental health care as a human right. When people are in crisis, they need help today. They should not be put on a waiting list to be seen months from now. That is why I introduced the Medicare for All Act in the last 2 sessions of Congress. Under this legislation, every resident of the United States would be guaranteed improved and comprehensive health benefits, including comprehensive mental health care. I have been a strong advocate for increased access to and quality of health care, including mental health care. This need is often more pronounced in rural areas and exacerbated by the shortage of mental health care professionals. I believe that we must encourage prospective mental health care providers to practice in rural and underserved areas through robust and continual investments in the National Health Service Corps, which provides scholarships and loan repayment for providers who commit to practicing in underserved areas. In my view, solving this crisis means increasing access to mental health services for all Americans across all racial lines, especially for those that are underserved. That is why I was a proud co-sponsor of the Health Equity and Accountability Act, which would work to reduce these disparities and those faced by working class people broadly. Please be assured that as ranking member of the Senate Health, Education, Labor, and Pension Committee, the member of the Senate Finance Committee, I will continue to fight to guarantee mental health as a right for all and for the rights of those dealing with mental illness. Sincerely, Bernie Sanders.
So next up, we're going to have a video from Senator Peter Welch. Well, that's getting queued up. I was just thinking about that statistic of 1 in 6 people. I personally don't know 5 people in my whole life, to say nothing of 5 out of 6, who don't have something going on in their mental health. Mental health isn't a static thing. We're always working on our mental health. We're always, it's maybe a DSM tells us that 1 in 6 people, but in reality, we all have fluctuations in our life. And throughout my career, I've become convinced that basically the antidote to mental illness or the swings of life are our sense of community and belonging, the relationships that we have in one another. And as Commissioner Haas was saying, that it's all about hope, and we find hope in one another. We find hope in the people who survive mental illness and addiction and the other things that we experience. We find hope in other people's examples. We find hope in our friends and our colleagues. So there's a data point that 8-minute conversation with a friend can change the trajectory of your life. So just know that all of us, whether we're mental health professionals, addiction professionals, whatever we are, our greatest tool is being a friend, is welcoming in people into our lives and our community, supporting them, listening to them, and believing in them. So just know that you all have the power to help people.
Are we ready? We're ready.
Sorry.
No worries. No worries. You ready?
Hello, and thank you for attending the 10th Annual Mental Health Advocacy Day at the Vermont State House. And thank you to all the organizations that co-sponsored this event and made today possible. You are doing very important work in our state by making sure that every Vermonter has access to mental health services. That effort is really important. And there's a serious lack of mental health support in our state, particularly among some of our most vulnerable communities. And I'm very proud to have co-sponsored legislation in the Senate to combat this crisis, such as the Pride in Mental Health Act. And as you know, that would strengthen mental health services for LGBTQ plus youth, and the Local 988 Response Act, which would improve access to the 988 Suicide in Crisis Lifeline. And in my time on the Senate Judiciary Committee, I've advocated for expanding mental health services to help reform the criminal justice system. Mental health care is health care, and it's vital we make it available for all Vermonters. I appreciate your advocacy, and much of what I do here is informed by what you advise me to do. Have a great day, and thank you for your excellent work.
Good morning to all the mental health advocates in the room today. Thank you for being here and for your tireless work. I wish I could be there in person with you, but please know I see and appreciate the power of your work. As many of you know, I'm one of the millions of Americans living with anxiety and depression. Like everyone, I have my good days and my tough days. And acknowledging that reality doesn't mean we're weak, it means we're human. In close partnership with all of you, I want to make mental health a normal and regular topic of conversation in every family and in every community in Vermont. Because we know that step one is doing what each of us can do to end the stigma. I also want to remind you all of the important role hope plays as we face a growing mental health crisis. Hope starts with us. Hope comes from the little things, from connecting with those in our community and our neighborhood. And hope is found in small, genuine moments of joy. And I seek out these opportunities every day. And that practice helps me to do my job better. Hope also comes with knowing that help is out there and that change is possible. In Washington, I'm working on legislation to make this a reality. My Combating Loneliness Act addresses social isolation and loneliness in our rural state and across the country. Long-term social isolation has proven to be more dangerous to our health than smoking. The loneliness epidemic affects many of us, but its impact is felt most acutely in our rural areas and among seniors and young people. It's an issue that affects Americans in every single congressional district. Social isolation also damages our civic engagement and our democracy. Our feelings of loneliness and isolation fuel anger and distrust in politics, and our loneliness is often manipulated to drive extremist ideologies. This crisis demands our attention, and my team and we focus on this each and every day. Please know I have so much gratitude for all of your work tackling the mental health crisis. We must continue this important work together. Thank you and have a wonderful day.
Yeah, you do your thing. Okay. Yeah, you got it.
Great. All right. So we're going to move into the next part of the day, which is our legislative panel. And so we have some wonderful folks who I'll bring up in a moment, but I do want to introduce our facilitator, which is Commissioner Hawes, who you've already met, but I'm going to read a wonderful bio. And I just want to say, we're really excited about our federal delegation. They easily, when I asked them to send videos and letters, they were more than happy to provide that to us. There are actual videos of human beings talking, and you just couldn't see them. So that will be available on the website, so you can watch those again. And the letter will also be distributed. So just wanting to let you know that there are videos and real people talking. So we're going to start the panel momentarily, but first I'd like to bring up the facilitator, Commissioner Hawes. So Commissioner Hawes has led the Vermont Department of Mental Health since July 2021. Originally from Kansas, yay Midwest, she spent 10 years in community mental health before moving to Vermont, where she worked at Clara Martin Center overseeing criminal justice and substance use programs. Emily's tenure at DMH spans more than 8 years, during which she has held multiple roles, including care manager director, and director of operations, planning, and development. She also served as the CEO of the Vermont Psychiatric Care Hospital before stepping into the role of commissioner. Throughout her career, Emily has been instrumental in shaping significant policy and programmatic advances, such as supporting the implementation of mental health urgent care, the development of Vermont's crisis continuum of care, and the expansion of peer services. Emily is deeply committed to making mental health care more accessible and effective for Vermonters, ensuring that services are available when and where they are needed most. And I just have to add my own note that Emily is a wonderful partner, and we collaborate with her and her team often, and she does care, and she's just an all-star. So very happy to have her as the facilitator of the panel. So I'll bring up Emily, and then Emily, you can bring up the rest of the panelists. Sure. So I see some folks in the back. I guess I'll announce them because I just think they're one. I'll do it. So we're going to have Senator Martine Gulick, Representative Brian Chena. We have Representative Diane Lamphere and Senator Jane Kitchell, who I see in the back, yay. You're all here, it's wonderful. Thank you all for making it on this snowy day. So please come on up.
2 and 2?
Yep, 2 and 2.
2 and 2. You just gave me instructions on that. Okay. Just gonna bring this down a little bit. Amy's pretty tall. All right. Thanks again for having me here today. We're going to have a panel of distinguished guests here. And I am going to start down here to my left. If you would like, Diane, if you would like to introduce yourself to the group, and then we'll just go down the line.
Sure, thank you.
You're welcome.
Test, 1, 2, 3. I'm not on. Am I on now? You are. That's good. I'll need another coffee. Good morning, and thank you, everyone, for inviting myself and the others here to join you on this 10th anniversary of this terrific gathering. I appreciate Amy Johnson's invitation. I'm Diane Lamphere. I live in Vergennes. I have served in a variety of capacities in the state of Vermont. I was a state employee at the Department of Health at back in the days when it was called ADAP. I ran for office, and I served over in the building that is next door here for the last 16 years, and most recently as the chair of the Appropriations Committee in the House. I am now transitioning back into a state employee now. I am now an employee at the Green Mountain Care Board. So a lot of things that are happening in healthcare this year. So just when I thought I was going to almost retire, I guess not. Thanks.
Good morning, everyone. I'm Jane Kitchell. I apologize. I have a cold that seems to love me and doesn't seem to want to leave. I have served in public service for 55 years, and I have actually retired. I spent 35 years in the Agency of Human Services. In fact, I predate the creation of the Agency of Human Services, which makes me actually have a lot of experience and a lot of history that has helped me. After I retired, I was secretary of the agency under Governor Dean, and then I ran for the Senate, and I have been just retired from the Vermont Senate, where I served for 20 years. I chaired the Appropriations Committee. And for me, one of the things about the Appropriations Committee that is so important is it's where all of state government comes together. And you can see connecting points, and you can see funding and policy come together. And to me, and Diane and I work together very closely, one of the things that you see is the budget's not just money. In fact, it's a policy document, and it's a priority document. And so obviously how we fund and what that funding level looks like, what our policies are really an important part. So when people talk about the budget, I just want to say the budget is really much, much more than simply an appropriation here or there. So it's a pleasure to be here today, and I look forward to hearing the panel.
Yeah, great. You can hold on to that.
I can?
That is for you.
Oh, all right.
And I'll come over to Representative Singer.
I don't know what we're supposed to say exactly to introduce ourselves, so So I've been I'll go backwards in time. So I've been a state representative for 8 years. I represent Burlington, Chittenden, the Old North, part of the Old North End, and the East District, Chittenden 15. And I have been a social worker with a master's degree since 2005, but I've been practicing with, whatever you call it before we're not allowed to call it social work before you get a degree, so whatever it was, working with people since 1998. And I actually have to give a shout out to Westview House. I see people came in from Westview House. That's where I did my internship in 2003. And yeah, and in 2004, we came here for Disability Awareness Day, and we made a movie that we were going to try to show a clip from today, but they couldn't figure out the technology. Sorry, maybe next year. But I have a lot of experience working with people, and I also have my own lived experience with mental illness and substance use issues that I won't get into right now because it would take up a lot of time. So I'll hand it over to Martine, or Senator Gulick.
Thank you very much. Hi everyone. I'm Senator Martine LaRocque-Ulick. I live in Burlington, and I represent Chittenden Central, which is a relatively new district. This is my second term, and Chittenden Central is Burlington, Winooski, Essex Junction, the city of Essex Junction, part of Essex Town, and a little sliver of Colchester, so it's a pretty large and populated district. Before I became a senator, I was a high school teacher for many, many years, so my lens around mental health, other than personal experience, has to do with my work in education, sort of on the front lines of dealing with adolescents on a daily basis, as well as the work that I've been doing in the Senate Health and Welfare Committee. And I'm really happy to be here. Thanks for coming.
Thank you. Let's do a quick round of applause for our guests. All right, well, let's get into some panel questions. Just so you know, I've made it this far in life and have never had to facilitate a panel live. So we'll have some grace today, and you guys will be amazing, I'm sure. All right, so question one. Over the past 5 years, what specific policies or funding initiatives have shown the most promise in addressing mental health needs and also creating long-term sustainable change? Whoa. That one came from Amy Johnson. No. Anybody want to take the first go at it? Yeah?
Sure, I'll start. When you sit on the Money Committee, it gives you a different perspective. And one of the things that has been a priority, certainly in terms of the Appropriations Committee, has been the level of funding to our mental health system. And am I doing okay in terms of volume?
Oh.
Well, I hate to because I have a cold and I don't want to infect Diane. So there's no question. I serve on the board of Northeast Kingdom Human Services, and so I know directly the importance of funding, and I know what the fiscal pressures are. And certainly healthcare, when we're looking at it, is a major expenditure. And so for the last, I don't remember how many years, in fact, and this is no criticism of the commissioner, but the governor's budget has included absolutely no increases for mental health, for base services. There's been some money for special initiatives. So one of the things that has been really important to me and I think to the entire legislature has been making sure that the funding has been there. It's not in the level that people would like, but has been there to increase and help provide workforce stability, because your business really is all around the quality of staff and that interpersonal and that consistency and stability of staff. And so again, this year's budget includes just level funding for our mental health system. And with the pressures of healthcare, that is certainly for me, once again, an issue that the legislature is going to have to grapple with. So I believe that the money that we've put in to help with the operation has been really important. But the other part, and I take great pride because it came out of Senate Appropriations, is actually embedding mental health workers with our state police. And that has been embraced, and that has been wonderful. And I think that, we had testimony in terms of the number and the increase of call-outs that really were more appropriately addressed by a mental health professional than a trained law enforcement. And it was great. We did actually expand that in last year's budget. So I certainly view that as something that has been of particular benefit not only to families, to the individual, but also to our criminal justice system in providing a more appropriate response. The other, of course, is the suicide prevention and the funding that has come with that. And then I would say mobile crisis, because we know that people in crisis, our appointment office-based system, it doesn't necessarily work, and we have to provide the response where people are. So I think those are really, in my mind, areas that we have made investments and policies that have that will have, I think, long-term benefit. But in the meantime, we have to deal with workforce and make our mental health agencies a competitive and attractive place to work.
Thank you.
Oh.
Anyone else?
Nope, go right ahead.
Did either of you want an opportunity?
I'll go quickly. I would just say, I know this is a really hot topic right now, but the federal funding that we were able to use during COVID, the ESSER and ARPA funds that allowed us to really bring mental health services into schools were huge. They had an enormous impact for our kids, their feeling of well-being, and just basically learning about themselves and about how their brains work. It was super empowering. I am concerned now that that money's going away, that we won't have those same supports. And I hear from folks sometimes, why do we provide mental health services in schools? When the kids go home on the weekend, they just lose everything. Not true. Schools, that's where we find kids. That's where they spend a lot of their time. And so being able to provide them those supports is critically important. And I am extremely concerned that a lot of that will go away, is going away as we speak. I would also just say, kind of going backward in terms of like prevention, right, and downstream supports. We passed a bill for doula care in the state of Vermont, and that is the kind of bill that provides supports to folks who are pregnant and birthing, and especially around postpartum, which is an extremely vulnerable time in a person's life. This is really critically important. So I hope that that is something that we will continue to work on, that we will get past the finish line. We want it to be covered by Medicaid, and that is what I'm going to keep advocating for. I don't have to talk to you about cell phones. I think we all know that they are part of our lives, but also need to be somewhat regulated and examined in terms of the interaction that they have on a child's brain and on the sense of well-being for our children. I could go on, but I am going to stop because I know former Representative Lamphere wants to say something, and probably Brian Sheena as well.
I think we're going to pass it to you, Brian, and then come back over here. There's a part 2 to this question that I'll come back to. So go ahead.
I don't think I have a lot to say about this. There's a lot we've done to improve the system of care, but the thing that I think is most significant has been the increased understanding of the importance of peer-based work and the shift to embedding peers in every part of the system of care. In fact, I mentioned Westview earlier. It's a peer-based clubhouse, and the model has been around since the 40s. So just to point out that like the shift in the rest of the system of care towards peer-based services, that there's so much I could say about why that's important. But especially right now when we see federal employees getting emails today saying that President Trump's willing to buy them out so they'll leave their jobs by next week, or we see federal freezing on funding, and we see, we don't know what's going to happen to the system of care, but in the end we have each other, and that's what peer-based work is about. So,
thank you. You can keep that. Your option, and to add on the end of it, is what can we learn from that, building a path forward?
Well, thank you.
Great.
I was just going to comment. Sometimes I realize that, there's time constraints, but I just want to echo Senator Kitchell's commitment to mental health. Her commitment over the many years, and I'm not just saying because she's sitting here next to me. I have been in the room when the door has been closed, and this woman is an advocate and a fighter for mental health and everything in the system that we have, from the law enforcement to 988, is because that she was there to make it happen. So now we have... It's true. I know there's a second part to this question, right?
I forgot it already.
All right. So.
But let me check my cell phone.
Okay, you check your cell phone.
It was what can we learn from those funding initiatives that have shown promise to build our path forward?
So I would say yes. We, as the other side of the appropriator that's been in the building for years, and now I'm on, within the system of care, it's about that really strong advocacy of making your voice respectfully heard and being in the building and making sure your legislators of all sorts know what is going on and what they need. I know that my Addison County CSAC is my neighborhood, and they just had to leave. I'm also, when I'm not all these other things in my life, I'm also grandma in chief, and I substitute at our local elementary schools. So it's really, really important that we continue to have that conversation as we're going forward, as so much is going to be changing in the world of education and how it's funded and structured. But it's going to be most important that we don't take our eye off the ball of the kids and the mental health issue that needs to be supported in that arena.
Great.
Thanks.
Thank you. Question number 2. While mental health is increasingly being integrated into our broader healthcare system, what more needs to be done to achieve true parity in access, funding, and quality of care? That was a heavy one, too.
It's like Countdown to Nirvana.
Okay, so let's put our oxygen masks on here. Any first takers? Oh, you stumped the panel. Oh, okay, yeah, that's good. Crowd participation. I know. Well, I have my phone that I'm addicted to, I think. While mental health is increasingly being integrated into our broader healthcare system, what more needs to be done to achieve true parity in access, funding, and quality of care?
All right, I'll take it first shot.
You take the first and you take the second. Okay.
So this actually is a part of where I'm, my transition out of being the legislator piece and back into the system of care. And I, as wearing now my Green Mountain Care Board hat, looking at the changes that have to happen within the system in order for us to continue to have a system that is important to keep the eye on the ball, that it needs to be more toward the community services and what has to happen at that level, because that is where the people are met. I had a conversation around this with some of the social workers within our school, and they gave me some very good advice. I'm not familiar with it, but Vision 2030, I don't know if you're familiar with it. She's very, very supportive of that and feels like there is great ideas there. We also need to continue to support to have fair wages for the people that are working in the workforce, that are doing this critical work. The parity piece that I can carry out of here too is that as the system of care and the healthcare system changes, that we need to bring more and more on the mental health side. Thanks.
Great, thank you. Go ahead.
I agree with everything I just heard. So I want to say that, but I'm going to take it in a slightly different direction, which is we've done a lot of work to treat medical care or physical health care and mental health care and substance use disorders equally. There's only so far we can go before we just have to accept that the only way we're going to ever have true parity is to have universal health care. I actually think that's really where we need to be looking. That once... So because because you still have to go through so many loopholes and barriers to get health care, to bill for health. Forget about billing. I don't know who else has to do billing in their work here, but it's like jumping through flaming hoops, to get paid and to get people services. And it should just be like people come in, you give them what they need, you get paid, they get paid when they help each other, and it should just be simple. So I think that's the next, we really need to look at how to get costs under control in the next few years and then take that leap. And it is in Vermont law. Act 48 is still in law. In Vermont state law, we are supposed to have a universal health care system if you read the law. So.
Thank you.
Sure. I would just add, sitting in the Health and Welfare Committee, the cost of health care in this state is unsustainable, to say the least, and tragic as well. So to echo what Representative Lampier said, we need to bring costs down. We need to make the system sustainable. I would agree with Representative Chena that we shouldn't have a for-profit healthcare system. But that said, we do at the moment. There is a bill that's going to be coming up this week, a birthing center bill. This is the kind of move that was recommended by the Oliver Wyman report, which really is to take some various services out of hospitals. I know we love our hospitals. They're so incredibly important. And we also need more access to care around the state. So these smaller, lower intervention healthcare facilities will be really, really helpful to folks. And again, we're talking about prevention. We're talking about meeting folks where they are. And I'm looking forward to seeing what comes of that later this week.
I guess is this on? No?
Yeah, put that up.
Is it on now? Okay. I think also we need to look at our organizational construct. Much of what we have, I view as sort of legacy systems back when we were operating very large institutions, and the way in which things get connected. And I think mental health obviously was off in a very separate and a very distinct part, and it takes time. And I predate the agency, and my view is if we really are to give the time and the leadership and the attention that's necessary to develop and overhaul a system so that it's more rational, better connected, and all the pieces are there as part of the system, my conclusion, and I've stated this before, our Agency of Human Services is too large. And I would like to move toward an agency of healthcare administration that looks at healthcare. And a lot of what we have is really over time ad hoc. So our separation of substance abuse services from mental health is an example. Yet we know 75% of individuals actually have co-occurring disorder, but our system is fractured. And I understand the work of the agency. It's huge, it's complex, it's half of state government. But I think if we want to give the attention to healthcare reform and look at all the important pieces from prevention right up through, it really is more than one administrator can really pay attention to when you're dealing with crisis and child welfare, to corrections, et cetera. Not that there aren't connecting points, and that's the one thing we all have to think about. In my mind, John Muir said it best, everything is connected to everything else. So if you want to underfund this, what is going to be the impact somewhere else? Or if you don't look at how this work connects and complements, then you find you're not getting the best return on the resources. So I'm putting in a plug again to really look at how we've organized our administrative responsibilities, our operational, how we get the best return and from a programmatic. And I'm terribly worried about what's happening on the federal level. We have, for decades, maximized federal funding. And that's really what's allowed us to do what we've done with healthcare, way beyond what 640,000 people could ever sustain or support. So I think we have to be very, very concerned. I've said numerous times, all the lofty rhetoric in the world comes down to cold cash. And I'm afraid the environment that we're in now is really going to thrust some very difficult circumstances on not only Vermont, but other states as well.
Thank you.
Would you like to commit suicide now?
Well, let's make sure that this is heavy stuff, and I want to make sure that we provide an opportunity, that there are resources out there if you are feeling like the subject matter is impacting you in this moment. And so those resources are 988, and certainly those folks are there to answer the call. I do want to loop back to some of the message that you had around the Agency of Human Services. And so there was legislation last year, Act 119, that requires the Agency of Human Services to take a look at the efficiency of the service delivery that the agency does, and that work is happening right now. And as a leader in the Agency of Human Services, I welcome that. I want to be a part of an efficient agency, and I think there are always opportunities to relook at the way you've always done things and see if there's better or more improved ways to deliver care. And so we look forward to that Act 119 work that's happening right now. And I think that legislative report might be due maybe next January. I think that's right. So thank you. Let's move on into question 3. What role do you see for early intervention and prevention in reducing the long-term societal and economic impacts of untreated mental health conditions? Yeah, go ahead.
So the older I get, the more I try to understand what the root of my own suffering is, and then what the root of our common suffering is as humans. And I won't get too into this right now because I'll just go on, But a lot of it has to do with attachment, if you study Buddhism ever, and what is healthy attachment, what is connection, and what are these unhealthy attachments we have. And then we become addicted to this roller coaster ride of highs and lows. This is the normal human experience. But then what is mental illness? When is it too much? And when I look back at what made it too much for me, and I was actually rewatching the Westview movie the other day as we were trying to figure out how to show pieces of it here, which we can't do because of technical issues, just so you know. But I have some copies if anyone wants to take some home with you from Westview that I brought. So I got distracted, sorry. But the reason I brought up the movie is because it made me think more about that, because we made it 20 years ago. So I was watching where I was at in life 20 years ago, and then where we are now. And it all comes down to trauma, I think. And I know that's trendy right now, everything's supposed to be trauma informed, but when you think about what pushes you past the edge of the roller coaster ride, I think it's when you go off the track, and or when someone hurts you, that's a big part of it too. We all hurt each other. I bump into you and say sorry, but there's a difference between doing that and throwing you out of your chair to take it, And so I share that because I think when we talk about prevention, we have to think about how do we teach each other how do I put this? How do we train each other or teach each other how to manage our own suffering better so we don't cause more suffering that's needless for others? And if that makes sense. So it's about community capacity, how there's no reason to make anyone suffer more than they already do. I'm sorry, there's not. And so even if someone kills someone, that is hurting them on some level. We don't need to torture them now. We don't need to lock them in a cage and make them suffer and make their family members suffer. That doesn't mean, though, that the victim shouldn't have justice or the victim's family shouldn't have justice. So I could go on about this, but I think we really need to think about how we respond to trauma and harm in different ways, and that's really the what's at the root of the prevention. I don't know. I'll hand the mic off because this is what I've said. It's a philosophical issue for me. Yeah.
So on this here, what comes to my mind, and I jot down right here, is awareness, access to care, and affordability of care. The first three things that come to my mind. Also is support for children. Once again, whether it's in school or otherwise, but our school and our community and after school. And the representative spoke there of the trauma-informed piece of that, having the professionals have the training that they need to be able to provide that. I also would like to bring into the conversation the fact that, having the access within the primary care setting and having the mental health counselors and issues right there to help in a pediatrician's office or in a primary care is another place to actually, I'll carry on into my next level of work. All right, thanks.
Well, obviously, we have tried to look at how we can provide early intervention and prevention. And certainly, so many of our strides have been, in particularly health, have been preventive, whether we're talking about the quality of water, our wastewater, immunizations, how we manage disease. But the human and emotional, to me, is also important. And that's children can really, if they've got a good mentor, or someone in their lives, constructive, can really do some wonderful things. So I think we need to start looking at how we make sure that some of those activities, we did that with mentoring, and the expansion of that, as well as some of the parent-child centers. Those are all examples of how we're trying to make investments so that families and children, and certainly as we're looking at mental health services for our seniors, and we talked about alienation and loneliness. I mean, those are all human dimensions that are so important, and they don't necessarily need medical treatment. They need that human connection, which is such a part of us. And I think the other important thing, and that gets into how we, as family members, or how we in our professional lives, identify those beginning signs of people experiencing those kinds of dimensions in their life. So I think some of it is sensitivity. I think the whole attitude and around mental health now is so different than it was 40 years ago. People of great stature are coming out and talking about mental health. And all of us have sort of been in that dark shadow. And I see that as really an important thing. But it's how we act on it and how we, even on an individual basis, respond.
Thank you.
Almost everything I would say has already been said, but I will put my teacher lens on again and just repeat, basic needs, housing, food, things that are absolutely essential to avoiding trauma and living in a healthy environment, super important. But also, we talked a lot about isolation today and loneliness. It's really important that adolescents, this was said, have a trusted adult in their life. That's incredibly important. And also that we all sort of engage in this third space, right? Not work, not home, but this part of society, our village, where we extract a lot of meaning there and we feel connected. And young people more and more feel that they are not connected, that they are hopeless, and that they are useless. So we really need to invest in that third space, and we need to, as human beings, be together and spend time together. We are more alone than we have ever been, and I'm not sure that's going well. And as we look at possible depleting resources coming out of the federal government, to Representative China's point, we're going to have to be there for each other. I know that sounds campy, but I really think it's true. Thank you.
Thank you. I'll just add my own little commentary because I'm standing next to a microphone and like to ad-lib. I think prevention, the definition of prevention, it also depends on how you're looking at that. And I know we've mentioned, food insecurity, housing, being screened at your primary care. But it's also, this is a form of prevention, being in this room and having dialogue and connecting with one another. And every time we have a moment of connectedness with another human, we are doing an ounce of prevention for ourselves and others. So just want to highlight how valuable that human connection is. I recently bought these cards that have little questions that are like, what's the one thing you're most proud of? And for my friendship circle, they love this. They don't. I was like, hey guys, I have this new card game. And they're like, great, we can't wait to play it. And then I pulled out all of these cards that were like pretty deep questions so that we could get to know each other outside of basketball and Chiefs football. And so just how valuable that was for a group of older, not too old, 40 to 60-year-olds connecting on that level, because we are not in a society that does a lot of time investing in those types of relationships with folks. So that's my own plug for this. Okay, so we are getting towards the end here. And so I have one last question, since we're almost out of time. In 30 seconds, are you ready? Okay. In 30 seconds, what is the main message that you would like the audience to take away? And I am going to start over here to my left with Diane. She looks ready to go.
I try to always be ready.
Main message is to just keep staying engaged. I think we're in for a bit of a road ahead, and we'll just, like the representative said, we're going to, at the end of the day, we're going to have each other, and we're going to have each other's back.
Very well.
I would say be open to change. Oftentimes we get into the way we've always done it, and I think it's really important to look at other ideas, other approaches, how we use our resources. And so I would say question the status quo, and how can we do what we do better?
Thank you.
Everything that you've been taught isn't true. Reality is an illusion. Your mind has the power to change the fabric of space-time, and so the quality of your consciousness and awareness can change the outcome of the universe for yourself and others. And don't forget the power that your mind has, and that there's always hope for recovery and for making the world better if we stay focused on that path.
Community, taking care of each other, and let's do hard things. I used to tell my high school kids that. Let's do hard things. Let's engage with each other. Let's put ourselves in uncomfortable situations. Let's resist. Thank you.
Anything, do we have any questions to take? One question? Ooh, one. Oh, yes, Ken, go ahead.
Ken Russell, Another Way, Montpelier. What the hell's going on in the world, and what the hell are we going to do about it?
Good question.
I mean, Senator Kitchell expressed, I think, some grief about what we're anticipating, and a lot of people are scared. And yeah, yesterday was a trip, and it feels like an elephant.
Yeah, great question. Does anyone from the panel want to take a first comment to that? Oh, I took your mic away, but I'm coming back. I'm going to turn it on. There you go.
My comment is, one, I don't obviously have answers, and we're going to have to sort of weigh it out. But in our helping relationship, our own anxiety, be very cautious that you're not transferring it over to the very vulnerable population that you serve, because they are going to feel very helpless, and oftentimes I think our own anxiety and our own issues permeate that relationship. So my warning is, please share your anxiety with your other colleagues, get the support that way, but don't create additional anxiety and burden on the very people that are already feeling sort of vulnerable to begin with.
Over here. Anyone?
You said, what should we do about it? That was the question. I think that we need to not give as much energy to it as it's taking from us. Like, they're sucking our fear up and feeding off of it. That's how, and enjoying this torture, like what Senator said about not putting anxiety on clients. We need to release ourselves from that anxiety too. It doesn't mean dismiss that there's real problems, but I think the antidote to the anxiety is the connection between us here now, not giving energy to a bunch of evil people in an office somewhere, cackling while they make us all suffer, which is what's happening right now, honestly. To be the elephant in the room is, literally an elephant in a room somewhere. So there's the elephants have taken the room. So that being said, let them have the room. We have the rest of the world. So what do I think we should do? We should all gather in public places and feed each other. Oops.
I didn't do that.
It's the man. No. That we should all gather in public places, feed each other, dance together, make art together, have fun together, and not let them ruin our existence with their toxic energy. That's what I think.
Thank you. That's all the time that we have for today, but thank you for closing with your inspirational remarks. I really appreciate it, and I think the group did too, because I got to see folks' reactions. So thank you all for spending your time with us. Much appreciated. And who am I going to? You? No. What do I do?
Daniel for the award.
Daniel! Thank you, panelists. Thank you.
These two. These are the ones that.
So if Senator Kitchell and Representative Gina, please stay here for a moment. And I believe somebody will be coming up to help us with the awards.
Am I the first one? Okay, I think we're starting with me, so that's fun. Me again. So I am here to present the Mental Health Lifetime Achievement Award. The Lifetime Achievement Award to Senator Jane Kitchell. So these are sentiments from Kelsey Stavseth. He is the Executive Director of Northeast Kingdom Human Services. He is not in this room today because I voluntold him to provide testimony in House Healthcare. So he's there, I'm here, so I'm going to read his sentiments. I'm presenting this award on behalf of Kelsey Stavseth, Executive Director of Northeast Kingdom Human Services, who cannot be here this morning. Jane has been an ardent advocate for mental health throughout her life. Her career in the Agency of Human Services, and then as a legislator, has allowed her to perceive issues from multiple perspectives. Additionally, she has been a board member at Northeast Kingdom Human Services and has always been an active community member here in the Northeast Kingdom. Recently, Northeast Kingdom Human Services went through a process of redoing their values. We came up with the following: person-centered, dignity, courage, discovery, and community. When I think about Jane's past and impact, it has been helpful to think about her through these values and how she represents all of these when it comes to her support of mental health. Her focus has always been on supporting Vermonters in need, centering them at the heart of her decision-making and pursuit of accountability for services provided. She has given all Vermonters the dignity of being seen and having their voices heard regardless of status, identity, or condition. She has demonstrated the courage to say hard things, push on the status quo, and provide no-nonsense advice and feedback when needed, but always in a thoughtful way and with the intention of serving the most vulnerable. She has always been curious, asking for information, testimony, stories, data, finances, and compelling narratives in her pursuit of discovery and moving forward on changes in policy, operations, and statewide initiatives that would have the biggest and best outcomes. She has always been a tireless champion of community, Vermont as a state, and right down to her hometown of Danville. From wielding the gavel in appropriations to baking tiered red velvet cakes for family and friends, she has influenced the large vision of stewarding the way forward for a state and the small human connections, remaining grounded as a person filled with empathy, humor, understanding, and integrity. Jane is a good example of what we can all strive to be: strong, courageous advocates and allies for Vermonters, for the dignity due to everyone in need of support, and for those due the recognition for their work every day to support the mental health of Vermonters. I am honored to know Jane, work with her still, and believe this recognition and award is well deserved. Thank you, Jane, for all you have done for Vermonters.
I'd like to say something. I'm sitting here thinking it's nice to hear these nice words and be alive to hear them. Oftentimes they come long after. I guess I would say who I am is greatly framed by my family. And I come from a long line of Vermonters, and my mother and father were always of that old farm tradition. It didn't matter who you were, whether you had no money, whether you just got out of jail, whether you were a U.S. Senator, you had a responsibility for others. And I think those values and those experiences I had growing up and the connection I have, I still live in my hometown, so I haven't made it very far in life, have really been good guideposts for me. And I leave after 55 years in public service. I feel really good about what I've been able to accomplish. I've been very fortunate. I look back. I was one of the mothers of Dr. Dinosaur, which for me is a big accomplishment. I've just taken and put together a package for retiree health care and pensions for teachers and state employees and dealt with that. So it's with that sense that I think I'm looking forward to some time for myself. I think a friend who is no longer a colleague who died said he was told, you've got more money than you've got time, and time is so precious. So that's my advice. Take advantage of time. Take advantage of your experiences, and don't put things off and then be consumed with only if. You can't do that in life. So seize the moment, and thank you very much for the award.
Next up to present the Unsung Hero Award is Brenda Siegel.
Hi there. I'm here to present the Unsung Hero Award to my friend and colleague, Brian Chena. And what I want to say about Brian is beyond just what he does out in the public and out in the world. I have the very unique not actually that unique, but I have a really wonderful experience of being able to work with Brian both on policy in the legislature as an advocate and also in the world, on the ground, working with people experiencing homelessness at the intersection of complex needs and disabilities. And we're able to go through that and both have been able to both be there for one another during what has been a significantly traumatic time for all of us, and to be able to be there and troubleshoot and work through challenges, impossible challenges of our clients and people that we see every day. I also want to share with you who Brian is as a person in the world, absent of those two things, and on a personal level. A few years ago, since we're at Mental Health Awareness Day, I had my own pretty significant mental health crisis. And I didn't talk to people about it. And there were a few people I would answer the phone for, and Brian was one of them. And Brian would say the things that I was not willing to say about what was happening, as someone who was a incredibly resourceful and a person who's able to do so much in a single day. To be struggling that way was not something I wanted to talk about out loud, and he was there every single day. And what I know is that he doesn't just do that for me. He will do it for any one of you, any person in the State House, any person on the ground who needs that for them, needs that right now. And so frequently, nobody is able, he's one of those people that does all this work and no one really recognizes it because he's not seeking recognition as he does it. He's doing it because it is truly who he is. So there is not a more appropriate award for him. And I know that he'd continue this work with or without being recognized for it. And in addition to all those things, he's able to make anyone laugh. Anyone that's interacted with him knows that. And so I have to say that thank you, Brian, for being such an incredible friend. Thank you for being such a hero, an unsung hero to so many people in this state. There are people all across the state, especially in your community, who every single day their lives are made with a little more hope, with a little more community, and with a little more love because you're in it.
I thought you were doing a picture and then you hugged me.
No.
Can you get one with her looking at you? She was hugging me. It was like the awkward fist bump, you know? All right.
The head bump. Aw, very nice.
Thanks. I don't really like awards, but if I was ever going to get an award, I would want one from you, so thank you. I don't have much else to say other than it's ironic that the Unsung Hero Award was given to me by Brenda Siegel, who slept on the State House steps while Governor Scott denied there was a problem. And look at where we're at now with homelessness. And it's like, I can't even talk about it without getting upset. I don't know how many more people are going to have to die before we do something. So let's just leave it at that. But thank you. I should tell a joke at the end. I don't want to make it so sad. But I guess the funny thing is that the Unsung Hero Award was given to me by Brenda Siegel because she also doesn't get credit for everything she's doing. So. I did think of something funny. I'm gonna go put this on my committee table and then like kind of move it around, so they all see it.
Could somebody come up who's going to be presenting the Rising Star Award?
Hello there. My name is Jacqueline Trainer. I'm the Events and Program Operations Director at Belkate School. I'm here to talk about Jamie Moore, our Athletic Director and Head Coach of Sports Programming at Belkate School, which is a therapeutic middle and high school for students with mental health and developmental disabilities. Each day, he welcomes students with joy and positive energy, and he helps to create opportunities for students to do the same for each other. Students at Belkate benefit from his acceptance and his support each and every school day. However, it is his work outside of the school day that has created the largest impact. Jamie has created connections with local colleges, high schools, businesses, athletes, news outlets, and more. Through these connections, he has facilitated social engagement, exposure to interests, built confidence, self-acceptance, and promoted family and friend bonding opportunities. Our students who struggle with depression, isolation, means to afford access to community activities, or may feel out of place, find connection, new interests, and are more active and engaged, and they're overall happier and healthier human beings. Jamie inspires new staff to the field. He leaves a lasting impact on those he's served, and his commitment and dedication to this field and work are unmatched. Therefore, Jamie Moore is this year's recipient of the Rising Star Award. Unfortunately, Jamie has the stomach bug that's going around our school, so he is not here today. But he did send some words for me to read. So he says, hello, and first off, I would like to thank NAMI Vermont for hosting this special event and awarding me this Rising Star Award. Secondly, he would like to congratulate Patrice Lumbumba of Winooski High School for also being nominated for this award. His dedication and leadership has created a safe environment for new American students, and he should be acknowledged for all of his work as also. Lastly, as one of the coaches of Belkate athletic teams, we live by the motto, we before me, and it would be selfish of me to accept this award without acknowledging the kids that I get to spend my time with. Yes, it is just my name on the plaque, but I would not be receiving this award today if I did not truly love what I do and who I do it with. The students at Belkate School have positively impacted my life as much as I hope to have impacted theirs, and I am forever grateful for them and my whole Belkate family for giving me my purpose in life. So thank you for listening, and go Bulldogs. Thank you.
Next up, we have the Excellence in Leadership Award. This year, we're presenting the Excellence in Leadership Award to Kathy Buscaglia. Kathy is Director of Innovation and Special Projects with Howard Center and has dedicated her career to supporting innovative programs in the mental health field. She successfully created a new home for 16 people, ensuring that those living with complex diagnoses such as intellectual disabilities, substance use disorders, or traumatic brain injuries have a safe and supportive environment. She spearheaded the opening of the new mental health urgent care, which provides an essential therapeutic alternative to emergency department visits for adults experiencing a self-defined mental health crisis. The Excellence in Leadership Award is being given to Kathy for her passion and dedication to these innovative projects that have made a lasting impact on the mental health community and provided invaluable services to individuals who may otherwise have been overlooked. Kathy Buscaglia.
Thank you.
Wow. Good morning. I'm so honored to receive the NAMI Excellence in Leadership Award. It's truly surprising and humbling. It means so much to stand alongside such inspiring individuals who share a passion for mental wellness. For me, leadership is about building connections, working together, and lifting voices that often go unheard. It's not something we do alone. It's a collective effort shaped by the incredible people we get to work with and learn from. This award isn't just about me. It's about the amazing teams, colleagues, and partners I've had the privilege to work with. Together, we've worked to create spaces where people feel safe to advocate for their mental health and embrace their unique journeys. To everyone who shared their story or fought for change, you are the heart of this work. Your bravery inspires me and so many others to keep going, even when the challenges feel really big. As we keep navigating the complexities of mental health, let's lead with empathy and inclusivity. By working together, we can break down barriers, challenge stigma, and build a world where mental well-being is a priority for everyone. Thank you again for this incredible honor and for the work you all do to support this cause. Let's keep moving forward together.
Finally, we have the Advocate of the Year Award, the Mental Health Advocacy Award. And we are presenting it this year to Kate Kappelman-Sins. Kate is a social work care manager through the Integrated Care Management Program at UVM Children's Hospital Pediatric Primary Care. She works closely with primary care pediatricians to identify and assess patients who require intricate care coordination, ensuring that each child and family receives the support that they need to thrive. Kate approaches each case with care and concern and a deep commitment to cultural competence, taking the time to understand the unique backgrounds and needs of the families she works with. Kate meets families where they are at, not only culturally, socially, and emotionally, but also at physical locations and at times that work for them. This helps build trust and ensures that the care plans she develops are both effective and aligned with the values of the families that she serves. In addition to her exceptional care coordination skills, Kate has extensive training in suicide assessment and treatment, allowing her to assess mental health needs with sensitivity and expertise. The Advocate of the Year Award is being given to Kate for her cultural sensitivity, unwavering dedication, and comprehensive approach to care. Kate Kappelman-Sins.
Thank you so much. Thank you.
Uh-oh. Okay, thank you so much. This is really overwhelming. Thank you to NAMI for everything that you do. It is such a privilege and joy to work with the children and families in our community. And while I have a microphone, I'm gonna advocate. So I'm sure I'm preaching to the choir, but I know we're gonna hear more about NAMI's legislative priorities today, and I just wanted to expand on a few of those. So first, we need to provide effective, accessible, and culturally sensitive mental health care for our community. Our BIPOC, immigrant, and LGBTQ folks are living in extreme fear right now. And many of them have already experienced significant trauma throughout their lives. So they're in critical need of access to safe and responsive providers. So we need to be providing that training and support to providers in our community. We also urgently need to invest in higher levels of care for youth in Vermont. Our state is sending youth to places like Virginia and Florida for mental health treatment due to lack of local options. I can't imagine the resources that go into these out-of-state placements. We have creative and brilliant minds here in our state. We could develop our own programs in Vermont so that our youth can recover in our state with their families and their providers around them. And then next, we must address social determinants of health, including safe and adequate shelter for all. I can tell you firsthand how the housing crisis has impacted the well-being and mental health of children and families in our community. This fall, for the first time in 20 years as a social worker, I had to scramble to find tents and sleeping bags for families that were being evicted from the motel voucher program. These are families for whom housing was not their only complexity. So their children with disabilities and mental health needs sleeping outside in Vermont in October and November. Last session, the legislature had an opportunity to pass H 829, which would have provided a long-term plan to address housing in Vermont. That bill died in the Senate. And I implore you to follow the priorities of the Housing and Homelessness Alliance of Vermont, to use the data and the expertise presented in their recommendations to develop a long-term plan to address the housing crisis. Finally, I encourage all of us to participate in ending the stigma for mental health and substance use. Every day, people in our community work, parent, live, and function with mental health and substance use disorders. I myself engage in the mental health supports in this community, as do many of my family and friends, and I am grateful for the care I've received. It allows me to do this work every day. Isolation and shame are life and death issues for people with mental health needs. So please talk about mental health, talk about suicide with your communities, your friends, your families, your children, and in the State House. And let's end the stigma. Thank you.
I just want to say congratulations to all of our award recipients. And I also want to mention all of the nominees that you brought forward as well-deserving recipients as well. And I'm sure it was so hard for all of you to vote on who these award recipients were going to be. But I want to congratulate everybody on all the work that you're doing. It is truly amazing. And now we'd like to go to sharing stories. And this is really the highlight of the day for me. And people are here to speak their truth. Sometimes it might be hard to hear what others have to say, but we want to keep an open environment for that and have an open dialogue. So please take care of yourself if you need to, as we talk about the truth that some people live. So in the chat will be resources for anybody who needs it, and Kathy is in the back of the room to help anybody. So we ask the participants to keep their story to about 5 minutes to allow everyone who's registered for the session an opportunity to share their story. And I would like to call up the first 2 people, and the second person can just be waiting to come up to share their story next. So I'd like to call up Jody and Jeanette. And I know we have an action-packed afternoon for everybody too, so please pick up the testimony schedule or the house map and join us. So is Jody here? Hi, Jody. And Jeanette, be waiting, okay?
Yes. Hello. Hello. Hi, I'm glad to be here. I'm going to keep this short. My name is Jody Gerard, and I am a mother, a wife, a writer, and a continuous survivor of mental health conditions. I live with post-traumatic stress disorder, trauma-induced hallucinations, and bipolar disorder. But E.E. Cummings said, "To be nobody but yourself in a world which is doing its best night and day to make you everyone else means to fight the hardest battle that any human being has fought and never stop fighting." I am nobody but Jody, and I'm going to share a little bit of my story. So I have been hospitalized over 40 times here in Vermont and in Maryland. And it hasn't been always great. The treatment is not always there. And one of the things that sustains the hope that I get when I'm struggling and I need to go and find help is that there are patients that are peers who talk to me, who we uplift one another. I was, just before COVID, I was in a hospital, and it wasn't very clean, and there wasn't a lot of staff because we're struggling to get help, aren't we? We're struggling with that. And so a lot of groups were canceled. And there was some people who were on staff who maybe they didn't mean it, but they were a little controlling. And as a writer, I needed paper. And they said, we are giving you 3 pieces of paper a day for your allotment. And I said, that's not enough. And they said, that's what you get. So, as a poet, I turned to some patients, and I started writing poetry to people to see beyond their despair, like me, see something that was beautiful in them. And I gave them poems with my paper. And then they went to the desk and said, Jody can have my allotment of paper. So I continued to write poetry to other people to get the paper. And when I was done, I wrote my latest book called The Long Haul there. I'm going to just do one more minute. The long haul is about the hospital stay there, and some of it wasn't great, but along the hallway were photographs from John David Geary, a photographer of Vermont. And so what I did was I wrote about jumping into these photographs, into these beautiful places, meeting my husband, so it's kind of a love story, and also meeting the younger me to try to talk and heal, because I couldn't find any treatment while I was there, so I did it myself, and also with the peers. So anyway, I'm really happy that I'm able to speak, that I'm able to share my words. I work part-time for NAMI Vermont, and I, as a presentation coordinator, and I train other people how to share their story. So I'm really excited for the people that are going to share their stories today, and I'm really happy to be here, and I am nobody but Jody. Thank you.
Thank you, Jody. You're such an inspiration to all of us, and she's ready to help coach anybody who wants to share their story. Jeanette, would you like to come up? And then next, we also have Julie, who will be waiting.
Hi. Good morning. My name is Jeanette Langston. I'm the founder and director of Social Tinkering, a Human Connection Project. Have you ever felt like you didn't belong? Like you were alone in the world and no one really cared? Every single one of us has felt lonely and isolated at times. And it's when this feeling becomes persistent and we have trouble seeing our own self-worth that this very normal human experience of loneliness impacts our health and our well-being. And it often sneaks up on us. I'm feeling a little overwhelmed with the amount of peers in the room today. How about you guys? Oh, I don't normally have this many peers around me, so thank you. Loneliness and isolation are complex issues that stem from the root cause of a persistent lack of connection. So what is connection then? There are lots of articles and books out there telling us how to find happiness and connection. Social connection is the answer. Get out and socialize. And the so-called experts are wondering why people aren't listening and why we're now dealing with an epidemic of loneliness. But they've missed a critical piece to why people aren't feeling connected. We don't need to be told that having friends can make us feel connected. We all know that. And the problem is that there are a lot of barriers that are preventing us from finding connection when we try. And then when we try many times and we just keep hitting those barriers, we want to give up. And that's when the really serious long-term impacts of isolation and loneliness settle in. Our human need to belong, to feel part of something and feel seen and valued is as strong, as critical as our need for food, water, and shelter. We just don't always feel the impacts of that not belonging as immediately. The pain from not feeling belonging, of being turned away and judged, not only leads to disconnection with others, but also disconnection within ourselves. One of the most significant barriers to connection, then, is all of our unhealed relational trauma and how this plays out between us, and how we are in relationship with each other matters. The quality of the relationship is what matters. Lack of connection is complex and negatively impacts our mental and physical health, driving how we treat others going forward. And that behavior is tearing families apart and preventing entire communities from thriving. We see social isolation and loneliness through domestic violence, crime, discrimination and inequity, substance abuse, depression and anxiety, higher rates of stroke and heart disease, and early onset dementia. Barriers preventing connection include things like the obvious lack of transportation or not enough money to participate in connection activities, lack of accessibility, and again, discrimination and bias, unhealed trauma, poor health, anxiety and depression, and ultimately, fear and shame are the ultimate barriers to feeling connected. You may notice some of the same issues are both indicators of isolation and loneliness as well as barriers, and lack of connection creates a complex cycle that requires just as complex and persistent solutions. The experience of loneliness and isolation is one of the most painful experiences we can go through as human beings. And when these feelings show up as we move through our fast-paced and fiercely independent culture, we tell ourselves, I'm fine, I'm fine. And we keep going. We are geniuses at keeping ourselves busy so that we don't have to feel our painful feelings. And when we can't stay busy, or if being busy isn't enough, we cope in different ways. Hiding away from everyone is a popular defense mechanism that tends to increase anxiety and depression and the loneliness. And desperately covering up the pain by self-medicating with substances is another common way we humans use to not feel the pain. If we do not work together to invest time and resources towards increasing connection, we will never sustainably solve our many community issues. In 2016, I realized how consistently and meaningfully connecting with others can help us to thrive. I personally began to heal my own loneliness. And in 2021, our team founded Social Tinkering, a human connection project in Rutland County. Our mission at Social Tinkering is to heal and reduce social isolation and loneliness by intentionally growing meaningful connections and compassionate belonging. We do this work from our own personal experiences with loneliness and isolation combined with global research. And we focus on hosting social connection experiences simply to be in a space together and start practicing talking to each other again, making friends. The simplest thing is the most powerful. And deepening understanding through education, and then we facilitate collaborations to implement actions to identify and reduce barriers. We're building a model of how we can intentionally grow connection for entire communities. And this year, we're launching a statewide coalition to coordinate resources to grow connection throughout Vermont. I'm here today asking our legislators to invest in growing meaningful connection to heal and reduce isolation and loneliness for all Vermonters. And I leave you with Dr. Vivek Murthy's final prescription for America. America and the world need a new generation of community builders, a generation defined not by age, but by spirit, by a fierce, unyielding commitment to each other and a clear-eyed, full-hearted recognition that we are kin, not enemies, and that we fundamentally need each other. We must be that generation. It is up to us to reject the pessimism and animosity of our time and instead choose courage and hope. The choice we make to build community has the power to change lives and transform society. Let us never forget that good people with hearts full of love can change the world. Thank you.
Jeanette, thank you so much for your leadership on this. And if any of you are interested in learning more about the social tinkering organization that she's created, please get in touch with her. I know she's looking for other passionate individuals to help with this initiative. So next I would like to bring Julie up. And Liz and Carolyn, if you could be waiting.
Hi everyone, my name is Julie Aiken. I was born in Vermont, raised here by my parents, David and Edith Aiken. I experienced my first episode of psychosis in 2001, before the Twin Towers were hit by an airplane, and we all experienced what I will call collective grief. The last time I talked to the legislature, I was 18 years old and Vermont was changing its drinking age. And I was on the wrong side of the law. And so I was like, come on, just a few more months, right? December, that would be great. I was arrested in September of the same year. If you have an alcoholic beverage and you are not 21 years old, you are in possession of something. And so I was arrested by undercover agents at a World's Fair, not my favorite day. I didn't tell my parents, they read about it in the newspaper later. Now, many people in this room are not old enough to know my family name. It's pretty big in Vermont. My great-grandfather was a governor. He was a US senator. He was tapped as a good Republican by a sitting Democratic president to construct the civil rights legislation that we have today. And I'm going to talk about that because in January this year, not only my civil rights, but the civil rights of my 80-year-old mother were violated over and over again. So I'm going to read our notice of rights as a person in custody or temporary custody of the Commissioner of Mental Health. These are our rights, whether we're in custody of the Mental Health Commissioner or not, but especially if you're experiencing first episode psychosis, second episode psychosis, third episode psychosis, or in the case in January, fourth time experiencing first episode psychosis and treated by professionals who have no training in psychiatric care. 1, you have the right to be treated with dignity and respect and consideration at all times, full stop. You have the right to receive services without regard to race, religion, color, gender, gender identity, sexual orientation, national origin, class, disability, and/or age. You are an involuntary patient. If you are, you have the right to a court review for your hospitalization. And here's a number to call: Mental Health Law Project, 1-800-265-0660. The Mental Health Law Project of Vermont Legal Aid has lawyers to help you. Yeah, you can get them on the phone while you are being involuntarily treated in a hospital. Now, here's the number again. I'm going to move on to number 5 on your list of rights. Everyone has these rights. You have the right to be free from seclusion or restraint, except in emergencies. You have the right to refuse medications and specific treatments, except in an emergency or when a court has ordered it after a hearing. You have the right to choose a family member or support person to be told that you have been admitted to this hospital. You have the right to have visitors, make telephone calls. You'll hear how a bunch of us end up in locked facilities and our phones are taken away immediately. Use sealed mail, use the internet, and send emails within reason. You have the right to take part in planning your treatment. You have the right to see your medical record within a reasonable time frame. Unless, oh, here's the catch, unless your doctor decides it would put you or others at risk. That's a lot of responsibility for a doctor. I would think a patient knows better than their doctor what they need sometimes. You have the right to make a complaint, which is called filing a grievance, about the hospital if you are unhappy about any part of your treatment, or if you feel your rights have been violated. You have the right to fill out an advance care directive, unless your doctor believes you do not have the mental capacity to make your own healthcare decisions, or you have a legal guardian. You have the right to vote, in case you're there during an election cycle. You have the right to vote while you're in the hospital and get help to vote. When your medical condition allows it, you may be moved to another place. You have the right to proper transport in the least restrictive manner necessary for your safety under Vermont law. This was published by the Mental Health Department, and I want to credit where credit's due, DMH 10/11/19. So this was published in 2019. It was revised. Oh, maybe they're doing it the European way, by DRVT, revised 10/24/17. So maybe 24, this was updated. In any event, I was thrilled to hear there is an emergency care, a mental health emergency care. I want to know where it is in case I need it. I believe there's no wrong door. If you go to an emergency department because you're having a physical problem or a mental health problem, hey, it's all the same. The Brandon Act was passed by the U.S. Armed Forces. If a soldier reports to their supervisor they're having trouble with mental health for mental health reasons, the Armed Forces has 24 hours to find them help. That'd be sweet in Vermont too. 24 hours to find help for a mental health condition, like actually real help, not someone who just graduated from medical school and has no training in psychiatric care, not that kind of help. I do believe that peers make a difference. I am a peer. I'm diagnosed with a serious mental health condition, hidden condition. Every time I go to a doctor, I get a new condition. It just keeps mounting. I think we need to train our support networks so that whether you have biological family or a chosen family who can help you, training is critical. And we must have local resources. We can't ship people out of state. Too many people would do a lot better in their own homes, and we're not even providing that for people. And then for the folks who don't have homes, those are our first priority. Getting some stable housing has to happen first. I mentioned my Republican family member. I actually have Democrats in the family too. So I want to give a shout out to Michael Obahoski. He was a state legislator here for a long time, and he was the Speaker of the House when civil unions asked to legalize and give proper credit to partners so that we can have people we love in our lives all the time. Thank you for your time.
Thank you, Julie, and thank you so much for your suggestions on how we can improve the system. There is always room for improvement. Is Liz available?
Can you all hear me? Yay. All right, good morning. I don't know if it's still morning, but my name is Liz Zolgett, and I'm so grateful to be here on this Mental Health Advocacy Day, my first one ever, and share my story with you all. I was 17 when I started college at the University of Vermont. I moved 6 hours away from my family, but I was ready to be independent and leave. In my first semester, I experienced recurring thoughts and feelings like the ones I had always had. I remember thinking to myself, something has to be wrong with me, or I am just losing my mind. After multiple attempts at trying to numb the thoughts and feelings, nothing worked. They followed me like they had since I was 6. They screamed, yelled, cried, and begged to be noticed, and I gave in. The waiting list for a therapy appointment at the CAPS program at UVM was over 3 months long, but I needed someone right away. I found a therapist off campus, but my out-of-state insurance barely covered it, so I paid mostly out of pocket. By then I was 18 and received an official diagnosis of OCD. After being with that therapist for 2 months, it was time for me to go home for summer vacation. I had to discontinue services because my therapist was not licensed to practice in the state I grew up in. When I came back for my second year, my therapist said she was full and could not take me again. So for 3 more years, I carried an OCD diagnosis with me, yet I had no therapy, medication, tools, or support. I continued to suffer in silence, even though I knew what was going on. When I was 21 and my OCD was once again consuming my life, I accessed my first ever exposure response prevention therapist. There are minimal ERP therapists here in Vermont, so I accessed support online. At over $100 a session, paid out of my pocket, not covered by insurance, I was finally in long-term therapy for my mental health. It only took 15 years. I stand here before you today, 24 years old, a graduate student at UVM studying social work, and an intern with the NASW Vermont, and managing my OCD well. I share my story as a familiar story many college students and young adults face. We are asked to manage our lives completely independently with strenuous amounts of schoolwork, challenging living environments, balancing 1, 2, or 3 jobs, internships, living paycheck to paycheck, refusing to go to the doctor, knowing how expensive the medical bill may be, all while trying to have relationships, friendships, and networking opportunities for future careers. And then we add mental health challenges on top. I fought hard to receive the care I needed. I am privileged in many ways to have been able to finally access that care. How many mental health workers and social workers are we losing because they don't have the ability to access their own mental health care? How many bright, talented, and passionate young adults are struggling right now that could be future politicians, advocates, and social justice warriors? The time to end mental health stigma has long passed, but we have an opportunity to do something today. College students need access to free mental health services. College students need access to 24/7 services. And college students need to know that they are not alone. I would not be here today without finally receiving the support I needed that was long overdue. I can only imagine how many others are out there feeling hopeless and lost. The time to promote well-being for young adults is now. I'm hoping that the stories you hear today will inspire you to create laws and legislation that make mental health a priority and a basic human right. Thank you.
Thank you so much, Liz. We really appreciate you sharing your story. Is Carolyn here today? I don't see Carolyn. Is Angela here? Okay. And then after Angela, Jenya. And then we have some videos.
So I titled this The Power of a Medical Diagnosis and the Support or Lack Thereof. For the sake of time, I'll try to keep these fun stories short. In January of 2021, on Martin Luther King Day, because it's always a holiday or a weekend, isn't it? That my then 15-month-old was diagnosed with type 1 diabetes. It was a whirlwind of how to keep my tiny human alive in the midst of COVID, no less. So due to hospital policy, my husband and I weren't even able to be in the room together at the same time. Oh, and did I mention I was 20 weeks pregnant after years of fertility treatments. After leaving the hospital, it was all on us to figure it out with next to no support from the professionals. The anxiety was next level, or so I thought. Hyperspeed on, those postpartum hormones, they're something, aren't they? Am I right? And what I had thought was just a colicky baby turned into a hidden cerebral palsy diagnosis for our second kiddo. But along this way this time, we had support in the form of an early intervention specialist, as well as a fabulous mental health clinician for myself, who was able to meet me where I was at. And honestly, those were very dark days, as I worried about the future, as well as managing everything that was on my plate. I'm pretty sure that those therapy appointments are what got me through. When I was finally coming up for air, about 1.5 years from that first diagnosis, it was time for me to get back to being me. That early interventionist, she helped me get my foot in the door at the local DA, where I started providing skills-based therapeutic services for kids in our county. Was it a lot? Oh yeah. But it also wasn't a far reach from the teaching background I'd come from. By the way, if anybody needs a physics tutor, I'm your girl. What I noticed was the work that I was helping kids set a strong foundation for their future. So while I was no longer prepping kids to go to college and kick butt in the laboratory setting, I was helping kids get to middle school, high school, and discover themselves along the way, and managing all the big feelings that come with the human experience. Hyperspeed mode again. Did I mention I got that adult ADHD diagnosis? Yeah, that was fun. My therapist compassionately supported me again with that too, completing accommodation paperwork and helping me discover what it means for me, for the better. I'm now halfway through my master's in social work program, and there are absolutely still days where I look at my own life and want to scream for more support. And there are days where I think we're doing all right. But above all else, I'm showing up. I'm showing up as my authentic self, and yeah, some days that gets pretty messy. But I'm showing up anyways to help set a strong foundation for Vermont's youth. So join me in celebrating the hard work that they have and continue to put in working towards a better future for Vermont. Oh, and if you know one of those rock star mental health clinicians, give them a big squeeze and remind them that they too are doing important things in all that they hold. Because it's not easy, but together we can support one another through this crazy thing that we call life. Thanks.
Thank you so much, Angela, for sharing your story. And Jenya, would you like to come up?
Good morning. I'm Jenya Morrison from Vermont. I'm a member of NEMI Vermont, part of America's largest grassroots mental health organization, the National Alliance on Mental Illness. As someone who lives with bipolar disorder, I'd like to share my story with you and ask for your support of mental health services. Before my struggles with mental illness, I was working in the mental health field, traveling, and becoming more independent. My life was going well until I had a manic episode. Everything that I worked hard for came crashing down. I started losing sleep, hearing things that weren't there, and taking dangerous risks. I was making irrational decisions and quit my job on a whim and drained through my savings. I had lost everything. I met with a psychiatrist and she prescribed me medication. After making some lifestyle changes, I started to feel better. I didn't want to be labeled as crazy, but I did not let this disorder define me. This is my first time sharing my story. I used to feel alone, but I'm glad I found a community at NAMI. We all have a voice, and it's our decision if we want to be heard. I hope I can inspire others to find strength in the midst of chaos in their mind. Fortunately, I was able to access services as soon as possible. Some people aren't as lucky, though. I believe we don't have mental health services in Vermont, or not enough. I can't imagine rushing to an emergency room for experience a mental health crisis and waiting for hours to get help. The wait times can worsen the condition and put a strain on the healthcare system. The homeless people are the most vulnerable. They often face extreme stress due to exposure of violence, food insecurity, and lack of stable housing. Without access to mental health services, these challenges can become overwhelming, leading to depression and suicide. This is the harsh reality in Vermont. Thank you for listening. Can I count on you to support legislation to increase the quality of mental health services? Thank you.
Wow, thank you so much to everyone who has shared their stories so far. You just get me for a moment because Lori is queuing up 2 more people who will share their stories from the screen in just a moment. I should have had like some jokes prepared. How are you doing? Almost ready. I don't know who has one. I know. Where did he go? Well, do you need me to change the screen?
I was abused.
Still doing that thing. So could you have her share all screens, not just that one tab? All right, so I would say just, it'll do the audio through it, so you'll be able to, yeah.
I was abused early in my life, and I learned to cope by listening to music, doing art projects, and talking to workers through my mental health agency. I used alcohol and drugs, but now I've been sober for 8 months. I have to remember to stay out of my head and do the things I have to do to stay sober and clean.
My name is Stephanie, and I'm a licensed clinical social worker in the state of Vermont. Two Vermonters born and raised. Growing up in the 90s, the 99% white society had some challenges. So I knew I wanted to dedicate my life to helping others. Fast forward to the college years, I had the opportunity to go to school out of state, and I was exposed to diverse cultures, diverse environments. It was a great experience. I also had the honor and privilege of earning my master's of social work degree from one of the 9% top-ranking School of Social Works in the nation. When I returned to Vermont a few years before the pandemic as a licensed LICSW, I was dedicated and excited to serve my community. Unfortunately, over the years, working at several different agencies and organizations in Vermont, it has not been a good experience. We are ready in a system where there's a lack of mental health services, a lack of qualified professionals. So to be a qualified professional here to serve my home state, it was very discouraging finding myself in situations where I was not being heard, not only professionally as a licensed professional, but also personally. I faced discrimination, retaliation, racism, all things that I didn't anticipate coming back to my small home state. Another challenge that I faced is I was in a situation where I was exploring reasonable accommodations for the first time, thinking that being employed at, a large mental health agency, they'd be able to support me and guide me. I was wrong. I wasn't supported, guided. Actually, the opposite happened, but that's a story for a different day. So, what is the solution for quality mental health services in Vermont? Supporting our providers. My call to action to you, hope starts here. It can, you can start in this very room. Prioritize quality and ethical services by supporting mental health providers. Invest in mental health providers. Invest in diversity, equity, justice, and inclusion efforts, not just performatively. Train people in positions of power about racial, cultural, and learning differences that could be affecting their employees or the clients served. Connect for mental health. Connect by listening to licensed professionals, making sure everyone is heard, making sure that everyone has a seat at the table. Connect for change. Thank you.
So we want to thank everybody for being here today. We're going to provide some closing remarks, and I just want to let everybody know that the show continues at the State House. So please join us at the cafeteria. Everybody can have lunch on their own. You can also attend the Cedar Creek Room. We're going to have a press conference there. At 3 o'clock, we're going to be in the House chamber being recognized. So please continue with this momentum. As well, we do have an evaluation form for you to complete. And I'd like to turn it over to Amy and Martina if you have other closing remarks you'd like to make.
Thank you, Lori. I hope that today can be a catalyst for all of us, that all the conversations, the partnerships, and the ideas born here continue way beyond this room through legislation, community initiatives, and by showing compassion to individuals on a daily basis. Each of us here has a role to play in creating a system that truly supports mental health and recovery. Together we can make Vermont a model for hope, collaboration, and progress. Thank you for your advocacy, for your passion, and thank you for your unwavering commitment to this cause. Let us continue this critical work because mental health cannot and will not wait. Thank you and take care.
Me again. I don't know why they let me keep coming up here, but they do. So I just want to remind everybody that the State House is the people's house, so that's you. And so it's really important that you know that advocacy happens there and you can be part of that. And I'm hoping that everybody comes over to the State House, and we have committee rooms that are taking testimony on mental health throughout the building. And I want to offer my services to anybody in this room, which feels overwhelming because there's a lot of you, but I want to talk to all of you. So if you're at the State House with us and you want to explore, you want to go into committee, know that it's the People's House. Know that you can go into most any room, and it's okay to walk in, to stand, to sit, wherever you can find space. But it's really important that you're present there and you're able to connect with your folks. And again, if you feel like that's overwhelming, because it is overwhelming, I've done it. I'm your kind of friendly, roundhouse kicking advocate for mental health that's at the State House every day. So I do it a lot, but it is overwhelming. So we are here to help you to navigate that process. So we have testimony in various committees throughout the day. We also have Lori doing a devotional at 3 o'clock in the House chamber, which is, I'm so excited for Lori, it's so cool. So please come to the House chamber to be a part of that. And then a Mental Health Day resolution will be read on the House floor. And anybody who's here for Mental Health Day will be recognized, and that's really special. You should be recognized. You're all kick-ass. So please make sure that you stick around, come over. They have really good soup at the cafeteria. Eat some lunch. Come find me. We'll help you get where you need to go, and just be a part of that voice in the State House. And I don't really have anything else to say that's impactful besides you're all awesome. Thank you for being here, and come find me and I'll help you navigate the State House. So thank you for coming.